Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for anal fistula. What is anal fistula? Fistula means abnormal communicating path between two different organs, such as fistula between rectum and vagina is called recto-vaginal fistula. Fistula between artery and veins is called arterio-veinous fistula, etc. Anal fistula means narrow communicating channels between various parts of anus and different parts of external skin. Look at this picture here. These are the parts of fistula. This is anus and this is the skin. The abnormal channel between these two is called fistula. There are so many types of, there may be so many paths. Anal fistula formation, how it is formed. Firstly, actually, within the space there is formation of abscess, and after abscess formation the pus is secreted. The pus must get some pathway to come out, so that's pathway or this pathway, and for that thing this fistula is produced. First, in deep-seated abscess is formed. The abscess forms, then the abscess ripes and pus is formed. Now pus must get out, so path is fixed by system naturally. That path is fistula. How anal fistula is formed? Two main reasons of formation of anal fistula. Number one, clogged anal glands. Number two, clogged anal abscess. Other reasons: radiation therapy, injury, tuberculosis, sexually transmitted disease like syphilis, gonorrhea, chlamydia or AIDS, cancer, Crohn's disease, diverticulitis. What are symptoms of anal fistula? Due to recurrence of boils, swelling and pains about the anus, which worsen in movement, sitting, cycling, etc. Number two, discharge of foul smelling, bloody pus from open orifice of anal fistula around anus. Number three, pains relieved after discharge of pus. Number four, inflammation and itching of skin around anus. Number five, pains during passing stool. Number five, fever with chill and rigor. Number seven, overall exhaustion and the disease state. On the right hand side, various openings. This is the opening, one opening. This is abscess, and another abscess. Who are predisposed to anal fistula? Number one, who have already been attacked with boils in anus. Number two, who have been or is suffering from diabetes, tuberculosis, sexually transmitted disease, hyperlipidemia. Hyperlipidemia means extra fat in the blood. Number three, who are habituated to take more oily, spicy foods. Number four, who are used to take smoke and take alcohol regularly. Number five, who have tendency to suffer from non-inflammatory type of skin diseases, dermatosis, such as alopecia, lupus, etc., who are used to lead sedentary lives. The starred, there are some points which are starred. Why it is starred? I am just telling. How to prevent anal fistula? Nothing is written. Some interrogation is there. That is, you have to follow the reverse procedure in the starred point. Such as, habituated to take more oily, spicy food. You have to stop it. Used to smoke, take alcohol. Used to stop it. Sedentary life. You have to give up this sedentary life. You have to take active life. So these are the preventing. I have not written that. For that reason I have not written here. The same thing, just opposite. Now remedies. Mercurius for anal fistula. Weakness with ebullition and trembling over least exertion. Troubles worse at night from warmth of bed, from damp, cold, rainy weather, during perspiration, during rest. Subject sensitive to both heat and cold. Anal area swollen, raw, sore. Tendency to formation of pus, which is thin, greenish, putrid, streaked with blood. This portion is mercurius characteristic. Mercurius pus is like this. This is thin, greenish, putrid, streaked with blood. Salice for anal fistula, it is related to all fistulas burrowings. Subjects chilly, hug fire, want plenty of warm clothing, heads draft, their extremities cold, lack of vital heat, catch cold very easily, they lack grit physically, morally. These are general symptoms. This is most important. Unless a general symptom corroborates with the patient, the medicine will not act curatively. Pains in anus with spasms of sphincters, anal fistula with chest trouble with purulent sputa, sharp stitches in anus while walking, discharges of anal fistula thin, watery, foul. Another thin, watery, foul is the characteristic of silicea. Phosphorus for anal fistula. Ulceration of anus with discharge of pus and blood. Anal fistula with tuberculosis affection or repeated bronchitis. Subjects low spirited, oversensitive to all impression, fear of death when alone, restless, fidgety, oversensitive to all external impressions like sound, light, touch, odor, thunderstorm. Calcarea phosphorica for anal fistula to relieve complications after surgical complication. Sometimes fistula is operated, surgically operated, and after operation there are complications. You may get some patient that is being harassed with this allopathic treatment and they have come to you. In that case, you start treatment with calcarea phos. Anal fistula alternates with chest symptoms. Subjects often suffer from pains in the joint with every spell of cold, stormy weather. That is, in each cold, stormy weather, then the symptom appears. Burning pain and pulsating in anus, bearing down towards anus, sore feeling in anus when getting up in morning. Their troubles seem to go worse when thinking of them. They are peevish, fretful, forgetful, but agile, always want to go somewhere. Causticum for anal fistula, frequent, sudden pressure feeling in anus, which is very sensitive to touch, itching and sticking sensation in the anus. Subject sensitive to cold and heat, both ambithermal. Restless at night, especially legs, moving continuously. They feel better in damp, wet weather, warmth of bed, gentle motion. Worse from change of weather, twilight, darkness from coffee, fats. Fluoric acid for anal fistula. Anal fistula of old aged persons, prematurely aged. They are impulsive to walk fast, like to move always. Averse to own family, near and dear ones, but converse with stranger pleasantly. Look at the peculiar picture. Fluoric acid. They are averse to own family members, near dear ones, but converse with strangers pleasantly. Worse from heat, alcohol at night, sour foods, better from cool bathing, short nap, rapid motion. Fissures affected place near puffy, indurated hardening. Discharges thin, foul, acrid, causing itching. This is the characteristic of fluoride. Fluoric acid discharges. Lachesis for anal fistula. Anal fistula in drunkards that tend to attract pulmonary complications. Pulmonary means lung complications. Parts appear blue. Parts means that anal region or fistula region. Blue, left side are much affected, constant urging in rectum, but no stool comes. Subjects talkative, religious minded, insanely jealous, maniac, crave coffee, alcohol. Their trouble seems go worse after sleep. These are general symptoms, most important. It must corroborate before giving lachesis. Then only lachesis will act very, very curatively. Aloe for anal fistula, heaviness, heat, burning, pulsating, itching, and stricture feeling in anus. Troubles worse from sitting after stool, fullness and pressing as if more would come. That is, more stool would come, but doesn't come actually. Jelly-like mucus lump comes out of anus. Subjects hot, worse in hot, warm weather, better in cold weather and cold water. Barberis vulgaris for anal fistula, constant desire for stool with violent burning and soreness of anus, burning and stitching pain in anus before, during, after stool, stitches in perineum extending to pelvis, short cough, chest complaints with biliary colic. Biliary colic means biliary colic actually it relates to your gallbladder. Hydrostasis anal fistula. Hydrostasis for anal fistula. Anal fistula with constipation, piles and ulceration. Almost always oozing offensive discharge so that subject obliged to wear bandages or pads below the orifice of anus. Discharge is first clear, white, transparent, then thick, green, even bloody, but always tenacious.